Hello, Interchange 22. I'm Camlus. I work for the United Nations Children's Fund, UNICEF. I'm also a postgraduate researcher with Lancaster University on the PhD Public Health Program. So my research interests span primary healthcare, health systems, and I am really keen on using critical realism. I'm going to discuss briefly what I am involved in as far as primary healthcare research is concerned. So, why primary healthcare and why am I interested in this research using a critical realist paradigmatic approach? Primary healthcare is in itself a very complex phenomenon if you consider it. This because there are multiple interacting components. The health system, for example, in Kenya, has elements of financing, service delivery, commodities, pharmaceuticals and non-pharmaceutical commodities, health information systems, and of course, aspects of leadership, governance, and even human resources for health. Now, laying that on one side, you find on the other side, there are citizens who need to have their rights to health fulfilled, and we have financiers who are not within government, as well as other policy influencers. Now, critical realism will enable me to, using this generative ontology kind of approach, to go beneath the surface and look at why it is that primary healthcare programs in Kenya and beyond are able to deliver results, and also consider for who it's working. So who is benefiting the most, who is being left behind, why isn't it working for those groups? And also, besides those, critical realism is really important because it will enable me to bring to the fore the fact that there are different approaches to studying primary healthcare, and there are different things to be known and different ways of knowing. So by that I mean different bits and pieces of evidence, as well as making judgments on which bits of evidence count, for who they count, and bring in all these multiple perspectives. So, having said that, I also need to acknowledge the need to bring in stakeholder voices in my research, as well as the diverse data collection, analysis, and synthesis approaches. So critical realism, I feel, is really this broad, it's sufficiently broad, but it's also a powerful. So critical realism is a powerful research paradigm that will enable me to uncover all these different layers of reality as far as primary healthcare is concerned. And it will also enable me to generate research that is actually useful for policy decision makers, healthcare strategists, and citizens to be able to bring to bear this kind of evidence on the policies that we advance as part of the movement towards universal health coverage. So in summary, primary healthcare is important. That fact needs no emphasis. Critical realism will give me that opportunity to uncover multiple layers of reality as far as primary healthcare is concerned, and importantly, generate useful, practical knowledge that government decision makers and other stakeholders in primary healthcare can use to tweak, design, redesign, shape, and make sure that primary healthcare programs in Kenya and elsewhere are leading to and giving us the desired change that we want. Ultimately, the goal is to attain universal health coverage by 2030, and primary healthcare is the vehicle to take us there. Thank you very much.